Hey everyone, today we're diving deep into what is without a doubt one of the biggest challenges in the medical device world, getting a high-risk Class D diagnostic device approved for the EU market. It's a tough climb, but we're going to map it out for you. Let's jump right in.
So, let me guess, you've poured everything into developing a groundbreaking diagnostic test, something that could genuinely save lives. And now, the big goal is to get it into the European market. You probably already know that getting that crucial CE mark is, well, it's a beast. But don't worry, that's exactly why we're here. We're going to lay out the roadmap you need. Okay, so here's how we're going to break this down. First, we'll get a real handle on the Class D hurdle itself. Then, we'll talk about mastering your technical file. After that, it's all about passing the notified body review. We'll also map out a strategic path to success. And finally, we'll cover what life looks like after you get that CE certification.
All right, first up, understanding the Class D hurdle. You might be wondering, what's the big deal? Why is Class D so different? Well, it represents the absolute highest peak of regulatory scrutiny under the in vitro diagnostic regulation, the IVDR. And trust me, there's a very, very good reason for that.
Simply put, Class D is reserved for devices that pose the highest possible risk not just to individual patients, but to public health as a whole. We're talking about diagnostics for incredibly serious, life-threatening diseases that can be transmitted. You can imagine the stakes just don't get any higher. And because of that, the regulatory bar is set just as high.
And this isn't some abstract theoretical category. We're talking about really critical, everyday medical tools. Think about tests for HIV, for hepatitis B, C, and D, even the tests that determine your blood type for a safe transfusion. These are things that absolutely cannot go wrong. The consequences of a failure, they're just devastating.
Okay, let's shift gears and talk about the absolute heart of your application, the technical file. You really have to think of this as the master blueprint for your device. It's the complete story, and honestly, it has to be rock solid. There's no room for error here.
So, what goes into this master blueprint? Well, you've got your device description and specs, all your manufacturing info, and a super detailed risk management file. But the real linchpin, the part that gets the most scrutiny, is the Performance Evaluation Report, or PER. This is it. This is where you lay out all your clinical evidence to prove, beyond a shadow of a doubt, that your device is safe, it's effective, and it does exactly what you claim it does.
Now this brings up a huge question, especially for manufacturers outside of Europe. What happens if all your amazing performance data was collected somewhere else, say in the US or Asia? Can you even use it? The short answer is tricky. It's a maybe, but.
Here's the deal. You can't just drop a pile of raw data on the table and call it a day. That's a definite no-go. What you have to do is build a bridge between your data and the EU's requirements. This means you have to prove that your findings are actually relevant to the diverse European population. You also have to show that your testing methods are up to snuff with international standards that the EU recognizes. So, for instance, if your study was done in Japan, you need to build a solid, evidence-based case for why that data is still valid and applicable to people in Germany, Spain, or Poland.
All right, so you've assembled this incredible, comprehensive technical file. It's a work of art. But now comes the real trial. It's time to meet the gatekeepers. We're talking about the notified body, and for Class D specifically, the EU reference laboratory. This is where all your hard work gets put under the microscope.
And when I say trial, I mean it. It really is a multi-stage gauntlet. First, you submit your file. Then the notified body doesn't just review the paperwork. They audit your entire quality management system. That often means they're coming to your facility for an on-site inspection. But for Class D, there's another huge step. The notified body has to consult an EU reference laboratory, an EURL. And this lab, they're going to get their hands on your device and do their own independent performance testing. Only after all of that is done and everyone signs off do you get a final decision.
So, you're probably wondering, where do people mess this up? It's a great question. The most common pitfalls? Things like an incomplete performance evaluation report. That's a big one. Or presenting clinical evidence that just doesn't connect to the EU population. Another classic mistake is a weak link between your risk analysis and your performance data. Basically, you haven't shown how your data proves you've mitigated the risks. Knowing these traps is honestly half the battle.
Okay, so we know the traps, but knowing about them is one thing. How do you actually avoid them? Let's pivot now from the problems to the solutions. Let's talk strategy. How can you get ahead of the game, prepare for this whole gauntlet, and give yourself the best possible shot at a smooth review?
Success here is all about being proactive, not reactive. You need to start by doing a thorough gap analysis.
Put your entire system up against the IVDR requirements and see where the holes are. Next, lean heavily on harmonized standards. These are the standards the EU officially recognizes, so they're your best friend. And you absolutely have to treat the MDCG guidance documents like your personal playbook. They literally tell you how the regulators are thinking. And maybe the most crucial point, get that strong EU-specific clinical evidence ready before you even think about submitting.
Look, this regulatory landscape is incredibly complex, and it's always changing. Let's be real, you don't have to be an expert in everything. Trying to navigate this all by yourself can be overwhelming. That's why bringing in experts, people who live and breathe IVDR day in and day out, can be an absolute game changer. It's a strategic move that can save you from incredibly costly delays and rejections down the road.
And just to give you a concrete example of what I mean, you have firms out there like i3C Global that specialize in this exact area. They provide that deep regulatory know-how to help you build a winning strategy, comb through your technical file, and really get you ready for that intense scrutiny from the notified body and the EURL. So let's fast forward. You did it. You navigated the gauntlet, you passed the reviews, and you have that CE certificate in your hand. That is a massive achievement. So congratulations. But, and you knew there was a but coming, the journey is not over. Not by a long shot. In fact, in a lot of ways, it's really just getting started.
Getting that CE mark opens the door to the EU market, but keeping that door open takes constant work. You're now on the hook for continuous post-market surveillance, which means you have to keep a close eye on how your device performs out in the real world. You've got to keep your technical file updated, submit periodic safety update reports, and have a rock-solid system for reporting any incidents. You have to think of compliance as a living, breathing process, not a box you check just once.
And that really brings us to the final, critical point. Getting certified is, without a doubt, a huge win. But the companies that truly succeed in the long run are the ones who think beyond that initial approval. They build a strategy for the entire life cycle of their device. So the question I want to leave you with is this. You know the science behind your device is brilliant, but is your strategy for what comes next just as strong?